first FDA-approved pill to treat postpartum depression could be available as early as October. Well, here to answer your questions, Dr. Ali Raja, Deputy Chair of the Department of Emergency Medicine at Mass General Hospital. Good to see you, Doctor.
Hey, Dr. Raja. It's great to see you. So help us narrow down on the focus, Dr. Raja. What is this drug called?
It's called Zurzuvae, and
Zurzuvae?
That's a lot of Z's, but
yeah.
Zurzuvae.
How does it work?
Well, so here's the thing. So based on a couple of studies that the FDA reviewed to approve the drug, it seems to work pretty well, but just as importantly, it seems to work quickly. So both studies showed a pretty impressive reduction in depression at 15 days, and in some cases as early as day 3. This is a really big deal because 1 in 8 women in the U.S. experience symptoms of postpartum depression.
Okay.
May I just interject for a second? For the last period of time, we've been using the term zuranolone. Is that the same thing as Zurzuvae?
I don't think so, but I have to tell you, this is brand new to me today, and I don't think that's the same thing.
Thank you.
And Dr. Raja, whenever you talk about new medication, you talk about side effects. So let's talk about that. What are the most common side effects when it comes to this drug?
Jessica, there were a few. Things like drowsiness, dizziness, diarrhea, fatigue. They're really noteworthy, but there's 2 things that are really worth focusing on. First is that in some women, the drug might actually cause, paradoxically, an increase in suicidal thoughts. So when you're on it, it's really important to keep talking to your doctor about your symptoms. And secondly, it may actually cause fetal harm if you get pregnant while on it. So it's really important to use effective contraception while taking Zurzuvae.
And let's extend that conversation a little bit. As you know, postpartum depression can develop within the first few weeks after birth. That's also when many new moms are still nursing. So is it safe to take this medication and breastfeed at the same time?
Ed, that's the million-dollar question. The studies that were used to approve it were done on women who didn't breastfeed to get the approval. And so we really don't know how it affects women who do breastfeed. So what's really important, as always, is to talk to your doctor about what the right treatment is for you based on how severe your symptoms are, your specific situation, and whether or not you should breastfeed or maybe switch to formula. Your doctor will work really well with you to make the best decision with you together.
Makes sense. Dr. Ali Raja, we always appreciate your time and your perspective. Thank you.
Thank you, Dr. Raj.
Thank you,
Take
Jessica
care.
and Ed.